Joining us now is Dr. Gloria Taliani. She's an infectious disease expert and member of the Italian COVID-19 task force and director of a clinic in Rome. Dr. Taliani, thanks for joining us. I'd like to start with what's going on here in the United States, especially New York City, which has once again shut down all schools. Are you surprised, considering New York was a success story after being the epicenter of the COVID-19 outbreak? I mean, what happened?
Well, it's not surprising me at all because we are perfectly aware that the mobility restriction is essential for reduction of the impact of COVID-19 spread, and possibly the reduction of mobility of young people. Let's say above 10 years old and below 30 years is essential because they are mostly asymptomatic and therefore they can spread infection without having any sign of disease. That's why the closing of the schools and moving to a remote form of teaching is very important to reduce the number of new cases.
Well, Europe has taken a different approach. They're, for the most part, keeping the schools open, but shutting down restaurants, gyms, and other businesses. Which approach is working better?
Well, this is very difficult to state on a general ground because it mostly depends on how much care people put in their movements. If all people wear masks, probably restrictions of activities in adults may be of higher impact compared to restriction in young people, which are mostly asymptomatic. And therefore, the two kinds of approach should be completed by a very careful message of wearing masks and keeping distance, physical distance between people, because this is an essential point to control the spreading of the virus.
I think everyone is exhausted and tired, and we want this to end, but it certainly seems to me, looking at Europe, the Europeans have accepted the reality. We don't see a whole lot of arguments. I mean, there have been some protests, but most people are adhering to the rules, wearing masks, keeping social distancing. But the Americans, perhaps, maybe not so much because it's become a political issue. Would you say that is part of the problem? Yes,
definitely it's like that, because wearing masks, especially in Italy, for instance, has been forced. It's a rule. It's not something you can choose to do or not. And we are totally aware of the problem. And until we have effective measures of therapeutic kind, we are aware that we can do what we can. And what we can is really following very strictly the rules the government has imposed us to follow.
Dr. Taliani, very quickly, we're running out of time. What is your message to people who are not taking this seriously? Quickly, please.
They must take it seriously. I wonder how many more deaths Americans want to face before they accept the idea that SARS-CoV-2 infection can be deadly.
All right, we'll leave it there. Dr. Taliani, thank you so much.